Good morning, everyone, to all members of the Public Accounts Committee. Welcome to this hearing of the committee. Very warm welcome to everyone who is listening in by radio or television this morning. This morning, the committee is reassembled to continue the examination of the report issued by the Auditor General regarding the report is titled Follow-up on Past PAC Recommendations 2021, which was issued in August of 2021. The report that was issued provided a status update on all PAC reports that had been tabled in the House between September 2018 and December 2020. It also provided a reassessment of the government's implementation of past recommendations for the two reports, ensuring quality health care and a healthy population, and also government programs supporting those in need, that was issued in May of 2015. Now, last week, Wednesday, the committee looked and examined their report, update on the report of government's programs supporting those in need. And today, we are now looking at healthcare. So with those introductory comments, I'll go ahead and ask the Sergeant to, if he would allow the witness to come into the chamber. Good morning, Chief Officer Pucci. Welcome to the Public Accounts Committee and to this hearing. Before we actually get started, I neglected to invite Member for Savannah to lead us in order prayer, so I'm going to ask her to do so at this time.
Thank you, Mr. Chairman. Let us bow our heads. Our kind Heavenly Father, as we humbly bow our heads before you this morning, we thank you for allowing us to see another day. We come to you today asking for your guidance, wisdom, and support as we begin this meeting of the Public Accounts Committee. As we deliberate, help us to engage in meaningful discussion. Lord, fill us with your grace as we do the work of the Cayman Islands. Continue to remind us that all we do here today, all that we accomplish, is for the pursuit of truth, for the greater glory of you, and for the service of our country. We ask all these things in your great name's sake. Amen.
Thank you. I am going to kick off the hearing at this point with, I'll lead off with the very first question.
Do you want the Attorney General to?
Oh my goodness. Yeah. I neglected the very and all-important step of inviting the Auditor General to make her opening statement with regard to this report. So, Auditor General, I shall turn things over to you at this point in time and invite you to make your presentation.
Thank you very much, Mr. Chairman. Good morning to you, committee members, colleagues and the listening public. Thank you very much for the opportunity to make some opening remarks, and you've covered some of the ground already. As you mentioned, this follow-up hearing relates to a report that we published in January 2017, which was about ensuring quality healthcare in a healthy population. And at the same time, alongside it, I also published a public interest report that described the healthcare system in the Cayman Islands, where it's a mixture of private and public and quite complex. And in that report, we also drew together some important data around underlying conditions, the demography and health-related data for the population. Further to that report, the Public Accounts Committee held hearing sessions in February 2017, several sessions with many witnesses, asking questions and following up on that report. In March 2017, the Public Accounts Committee tabled its report in the then Legislative Assembly on the 27th of March. The PAC made a further 3 recommendations in addition to endorsing the 9 recommendations made in my report. In June 2018, the government minute with the formal response to the PAC's report was tabled in the Legislative Assembly. It's worth saying that standing orders require these to be tabled within 3 months, and so this was already a year late. In October 2018, we published a follow-up report on past PAC recommendations, as we do, and as you referenced, this is a further follow-up report. We assessed at that time that the progress made against the recommendations in the healthcare report as amber, the main reason being that the government accepted most of the recommendations, and we assessed it as some progress because most of the dates for implementation were yet to come. They were mostly due in 2019. In January 2019, the PAC took evidence from the then Chief Officer of the Ministry, and in April 2019, the PAC tabled its report in the then Legislative Assembly on the 10th of April. It added a further 2 PAC recommendations, additional recommendations to the 3 they made before and the 9 OAG reports, making 14 recommendations in total. It's important to note that since April 2019, there has never been a response received to the government minute, which is contrary to standing orders. So this then brings us round to this further follow-up report, where we obtained an update in January from the Ministry, and thank the Chief Officer for that. And in August, we've published our follow-up report, where we assess the follow-up as read now, in that a number of dates have been missed and there's limited progress. I have with me today Angela Cullen, and we'll be happy to help the committee with any questions. But I just want to say that these recommendations are really important because the intention is about improving the health of our Caymanian residents, whether served by the public or the private healthcare system, and ensuring greater economy, efficiency and effectiveness out of that health system. Thank you, Mr. Chairman.
Thank you, Auditor General. As I mentioned before, I'm going to kick the questioning off with the witness, and after I ask you the question, Ms. Pucci, if you just state your name and your position for the record. Okay? So, Ms. Pucci, the Auditor General's introduction has outlined a timeline of key milestones in relation to this report, which dates back to January 2017, and as she mentioned, also almost 5 years after the original work. The audit, her latest update states that limited progress has been made in implementing any of the recommendations made by her office and the PAC, which is aimed at improving health care. And she mentioned specifically that specific assurances were given to the PAC in 2018 and 2019. Can you tell this committee what are the reasons for the delays in really acting on this report, since it really is close to now 5 years since the report was prepared and issued? And so grateful for your views on the overarching reasons as to why there's been no progress.
Good morning, Nellie Pucci, Chief Officer of the Ministry of Health and Wellness. Good morning, Mr. Chairman. In response to your query, obviously we're looking back about 5 years, and that is, some length of time. However, to put things in context, I cannot speak to what was recommended, promised at that time, and in terms of the timelines that were given by which stuff would have been implemented prior to my acting role in this capacity at the ministry, which was at the end of 2019. So prior to that, I can't speak to specific delays and reasons for delays at that point. Obviously, from my time in assuming the acting role, within 3 months, we were full-fledged into COVID. So that dominated my last year and 2 years in that acting role. With COVID being full onslaught for us in March of 2020, obviously the ministry was dealing with just the emergence of it from January of 2020. But fully onslaught in March of 2020, that dominated our focus at that time and continue to do so, unfortunately. So in response to why we haven't implemented some of that, I can say that I have not been able to focus on that, on those specifically prior to getting to this point. I've been appointed in this role effective September 1st. So it does take me now, it will take me some time to be able to go through and see what we have to do from a ministry standpoint in that regard. And obviously that will require resources to do so. So we'll get in more to that aspect of it, but that's just the overarching summary from my point.
Ms. Pucci, I don't hold you responsible for what would transpire prior to your taking over, but to my thinking, certainly it would be people within the ministry who would be responsible for this. I mean, it would appear to me from the Auditor General's report that nothing really had been acted on. It's chief officer's role to drive the implementation and responses, but inevitably there are others who are, for want of better words, doing the legwork in responding to these recommendations and implementing them if they have been accepted. I mean, is it the case that the ministry just hasn't picked this up and dealt with anything?
Okay, so to further put into context our conditions at the ministry, when I assumed the acting chief officer role, I had no deputy. I have no chief financial officer, so I was covering some of the key posts at that time for quite an extended period of time. We've obviously put into place a chief financial officer within a few months after, so that person's been on board since then and helping in that regard. My deputy commenced in June of this year. The other deputy position never moved forward. We've just recruiting now in terms of staffing up. In terms of our policy persons, we have 2 persons in policy in the Ministry for Health, a senior policy advisor and a policy advisor. So it's against that backdrop that I look at what time frames were promised in terms of implementation, given the very limited resources from then. So just to continue, Mr. Chairman, so it's not that the ministry doesn't see these as important. They were accepted and deemed to be relevant and wanting to be implemented. That was the assurances that were given. So I don't think that is the issue. However, the resources behind doing the implementation and within the timeframes that were said to this body, I don't know if those were feasible before, and certainly not within the time that I've been here, given the COVID that we've been dealing with, sir.
Okay. Well, thank you very much for that explanation, Ms. Pucci. What sort of commitments can you give this committee that this report will be action, looked at an action by the ministry?
Mm-hmm. So since appointment, since the last couple of months, maybe 2 or 3 months now, in terms of getting a deputy, trying to get the ministry reorganized in terms of the human capital resources that we require to be able to fulfill our duties sufficiently and to the standard that we expect as well. We have gone through our restructuring. We have looked at additional posts that we need to implement to be able to carry out these duties. Obviously, as I said, with the limited resources and you're in a pandemic, the focus has been on that pandemic. So whereas a lot of entities may have gone back to a bit more of normalcy in terms of being able to look at all your other strategic goals and what you would like to accomplish and carry out, and moving ahead some of those, the ministry has not had that luxury just yet because you're still in the pandemic. There's still so much that happens behind the scenes to be able to continue to provide all of the necessary changes that happen in that. So that is just one aspect. I'm not saying that in terms of saying, well, we can't do anything because of COVID. It's just that's our reality at this point in terms of the resources that we have. So we've looked at how do we strengthen then our policy group to make sure that we have persons who can look at these other aspects of it and to drive it. So we have a new deputy chief officer. We've put out for an additional one. That recruitment process is just underway. So we're hoping that we'll get someone fairly shortly in that regard that will help to strengthen it. The deputy chief officer that we have now is specific to health and admin, so that will help to focus on that. But as I said, we are in a health pandemic as well. So it doesn't afford us then the opportunity to just go business as usual, and is just not there just yet. We're strengthening up our senior policy group at the top in terms of CMO, medical officer of health, adding some additional persons in the public health arena at that top level that helps to drive the national policy on health. That's something that's been a bit lacking for quite some time, even in terms of data analysis, on statistics and so forth in that regard. So it's strengthening up at that top level so that we're able to provide resources there and to be able to deliver at that point. We've also looked at adding additional senior policy advisors and a policy advisor, persons specific to do project management. In this regard, we see these as a project, as a mini project. These are things that we need to carry out and that you need to be able to focus on. Our ministry did not even have a communications officer, so we have our policy people into that because COVID is ongoing. You have daily communication demands. So it's looking at those gaps and trying to fill that, and we've done that in terms of getting the job descriptions, getting the necessary approvals, going through the recruitment so that we are able to now staff that up. Those have been budgeted for as well in the upcoming budget process.
Thank you. I mean, so listening to you, I mean, it seems to me that you have a real issue, severe constraints with lack of personnel within the ministry. That a fair assessment?
Absolutely, sir.
And are you getting support from the leadership with regard to trying to fill the posts that you have vacant and that you might be looking to fill?
Yes, sir. So far we've gotten that in terms of approvals to add these additional posts to our ministry, and also budget approval in terms of the upcoming budget to be able to carry these posts forward. So we do have the resources currently to be able to fill them, and we've gotten the approval to do so. Yes, okay. Sir.
The other question I wanted to ask you, in the Auditor General's background or introduction to it, she mentioned that the PAC tabled its report in the Legislative Assembly on the 10th of April 2019, but to date there's not been a government minute in response to that. Can you tell me why, like more than a year later, almost a year and a half, there still is no response?
Okay, sir. I'm not exactly sure who's responsible for tabling the government minute. I don't know that it's me, but I stand to be corrected in that regard, but I'm not aware of that.
I think the responsibility ultimately would lie certainly within the civil service, and I believe my view is ultimately with the chief officer in the ministry to which it relates to. Mm-hmm. So you're best placed, that person is best placed to deal with it and to respond to the PAC's recommendations. Mm-hmm. And then my recollection is once that's done and agreed, then the report itself goes to the government itself, to the cabinet for approval and submission here.
Okay.
But there is a time frame, and it's relatively short. It's 3 months, which I know can sometimes pose a challenge, but it just strikes me that 18 months is a bit much.
Yes, sir. And so I would not even have been privy to a lot of this until really late in last year, early this year.
Yeah.
So and then in terms of the government minute, I know that the chief officer was consulted in terms of giving the updates, but ultimately it was not tabled by me.
Yeah.
No, sir.
But, I mean, can we get a commitment from you that you would, take this forward to make sure that the government minute is completed and sent down to this House? Because otherwise, our work is incomplete, and we are. Again, we are the supreme body in this country, and I think it's important that the processes that are in place to ensure good governance and are upheld and dealt, that we do stick to them and make sure that that we follow them. Absolutely. So I'd plead here from the committee that you give us a commitment to look into this and get the report prepared and sent down here.
Absolutely, sir. And
Thank
I will
you.
seek to endeavour what else remains outstanding for our ministry as well, so that I'm aware of what else hasn't been done previously. Thank you.
Financial Secretary.
Yes. Good morning, Mr. Chairman, and good morning to committee members. I just simply wanted to elaborate a little bit more on what you just said and to support what you just said. The procedure for the government minute being tabled in the Parliament is relatively straightforward, and as we all know, the Auditor General's report has detailed at least about a half a dozen government minutes that have not been tabled here in the Parliament, ranging from the Segregated Insurance Fund, a report on SEMA's financial statements, and so forth, and the effectiveness of some reports, etc. The procedure, Mr. Chairman, to get a government minute tabled here would be that the ministry portfolio office that has the responsibility for that particular subject area would be primarily responsible for drafting a cabinet paper, and as a result of discussion with their minister, their official member, the cabinet paper would essentially say, here's a report from the Auditor General, which in turn is substantiated then by a report from the Public Accounts Committee itself, and it contains recommendations. The chief officer normally would say to the minister, we think that we can agree to this or not, and within this time frame, I need to do a cabinet paper, either rejecting the recommendation or accepting it, and so forth. And so the cabinet paper is drafted, it's taken by the respective minister, official member to cabinet to say, this is the government's proposed response to the Public Accounts Committee report. And assuming that that's approved in cabinet, then the next step is for it to come here in the Parliament and be tabled usually it's by the minister responsible for that subject area, but it could be, for example, by the Premier. It doesn't have to be specific by that minister, but that is the procedure. So it's a cabinet paper accepting or rejecting the recommendations in the PAC report. Once that occurs, then it should be brought by the minister, Premier, as the government's official response to the Public Accounts Committee's recommendation.
Thank you, Mr. Financial Secretary. I'm going to invite now other members to make some questions, but before I do, there's another matter that I just forgot to mention when we were starting, and that is I want to acknowledge the presence of Mr. Seymour, the member for Boddentown East. Now, during the period when this report was prepared, he was the Minister for Health. And so he does have a very direct conflict in the hearing of this report. And so he will not be questioning the witness here today, but he is going to sit through the hearing, but not participate. So just want everyone listening and watching to understand and know that that is the case. I'm going to move on now to address an issue called question and area regarding the strategic plan for health care. And I'm going to invite the member for West Bay Central to lead off with the questioning in this area.
Thank you, Mr. Chair. Good morning. I will start by referring to the recommendation number 1, which the OAG reported that the Ministry of Health had issued its first national health policy for the Cayman Islands for 2012-2017, but found that the government had failed to take reasonable action to implement the strategy. And I know, Ms. Pucci, I know you just set out some explanations in relation to another area there. I think it was the report. But just to go on further here, the recommendation stated that the government should update the policy, including developing the operational plan necessary for its implementation and the monitoring and evaluation plan required to track progress and results. And I actually had a look at the report, at the policy, and 2 of the strategic directions that jumped out at me is number 7, develop a robust health information system with multi-agency linkages to improve the quality and coverage of health-relevant information to be used for decision-making. And then number 8, promote increased research for the production, dissemination, and utilization of health-relevant information, knowledge, and scientific evidence, again, for decision-making. So my first question to you, Ms. Pucci, really, again, just to ask if you could elaborate. I'm guessing that a lot of the explanations that you provided to the chairman will be very similar, but is there anything else that you could enlighten us on as to why there may have been a delay with implementing the strategic part of the plan for healthcare? I mean, if there's nothing additional, you don't have to go back through that lengthy explanation. I'll just go on to the next question.
Okay. Yeah, thank you, Mr. Chairman. Through you, as I said before, unfortunately, it's a little bit difficult for me to say why it wasn't implemented at that point, or even up to the time that it was said that it would be in terms of 2018. I'm not able to add anything further as to the reason why that has not happened. As I said, I've spoken mainly from what's transpired since my acting time in 2020 and what that focus has been for me in this role. But I cannot speak to us, what really prevented it at that point.
Thank you. And I guess going back to the directions that I just read out, 7 and 8, that leads to my next question. I guess looking at the chronology, I don't think anybody would have ever imagined that we would be facing a global pandemic right now. And so failure to have those directions solidified into a policy where we have a strategy to help with decision making. Do you see that then as a risk for us as a country to not really have a strategy for healthcare right now?
Mr. Chairman, through you. So the various councils' legislative framework that is in place ensures then that the quality of healthcare is held to that high standard. Where the policy not being implemented, it really impedes strategic progress in that regard and what you might envision the healthcare system to be for the country. So in terms of risk to what is being provided now, I think those measures are in place in terms of looking at practitioners and so forth. However, in terms of the direction of where you may want to improve healthcare and see it going in the future will be where that plan now becoming operationalized would be more helpful in that respect.
Last question. I guess just to elaborate a little bit more, where I was going with the question is really more dealing with the data that we need as leaders to make the right decision now in terms of keeping our country safe and keeping our people safe. To my knowledge, I know we have the councils and we have the chief medical officer, but that information for decision making that would be collated, subject to a plan being in place, that's what I'm referring to. Failure to have that mechanism in place, do you see that as a risk in terms of the decision making that is currently in place?
Mr. Chairman, through you. So in terms of a risk, I think it just means that we have to do that much more in the absence of the plan and having to draw on a lot more resources at that point to make sure then that we have all the necessary data that we need to be able to make the relevant decisions, whereas a plan would have that in a more streamlined manner, I think, of how that happens. In terms of the guidance that we receive for a national level decision making, that CMO, for example, would provide a lot. We have a lot of relationships with Public Health England, other entities like CARFA and PAHO, so there are those resources to draw on. I think what's been lacking from a Cayman perspective for some time is to have that database of national data, and we are limited to in terms of whether we have outbreaks and so forth to actually have the data, but even in spite of that, just making sure that we know what our numbers are and what they mean from our perspective. So that's where some of the thinking currently is in terms of adding at the more senior policy level, for example, in terms of epidemiology, to have that national epidemiologist that would help in that regard. Yeah.
Thank you, Ms. Pucci. I'm glad that this all came out and the listening public can now have a better understanding, because as you said, failure to having a streamlined process and the lack of the national healthcare data does make decision making a bit more challenging. Thank you very much.
Thank you, Mr. Chairman. To you, Ms. Pucci, what is the Minister's plans to develop a healthcare strategy and the operational plan to support its implementation?
So the current plan is nearing the end of that time that it was really designed for. So it's being able to go back and look at it now in the context of, is it still relevant to what we have? And I think the current one that we have in terms of the national policy, is 2017 was our date for that, and being able to now look forward to say, okay, we're ending that time. We need to now get in gear as to renewing that plan and updating the plan. So that has to happen. That's ongoing work that still needs to occur to update it. Mm-hmm.
Thank you.
Thank you, Mr. Chairman. Through you to the Chief Officer. Can the Chief Officer sort of give us some undertaking or some timeline as to when the updating of this plan will occur?
Mm-hmm. Yep. So once we have our, Mr. Chairman, sorry, through you, once we have the resources in place that we're currently undertaking in terms of recruitment, then it's bringing together then the relevant stakeholders to now review that plan and update it as necessary. Yeah. So I'm looking to say that within the next 6 months, we should be able to get back into that frame of having the relevant groups and then being able to look at the plan and see how we go forward. Bearing in mind that some of our partners, our stakeholders, regional, internationally, are also still in pandemic mode as well, and so it's also difficult then to look at other aspects of healthcare just because the sheer magnitude of what you're dealing with, you have to just reprioritize in that aspect. But not saying that it's not that we're not looking at it completely and just totally just all COVID. Unfortunately, we can't just do that, but it does. The pandemic does dictate how much focus or priority you can give to it at the current time.
Through you, Mr. Chairman, to the Chief Officer. You mentioned that you all will shortly be recruiting another Deputy Chief Officer and some strategic officers, what have you. Do you have the actual budget in place to recruit them now, or do you have to wait until January based on the budget, the 2022-23 budget?
Mr. Chairman, yes, we do have the resources in place to be able to do that, and we've sent out our advert just recently for the additional Deputy Chief Officer.
Let's take that a little bit further. How many staff, what's your staff complement in the ministry?
So currently we have 12 persons. Yes, for the core ministry. Yes, sir.
Okay, so that hasn't changed in a number of years. I can speak to that. And how many people how many positions are you actually trying to recruit and fill at this time?
Yeah.
It looked to me like about 3 or 4.
Yes. Currently we have 5 that's on stream, and then the other national ones that I was speaking of are then in progress. So they're not yet recruitment ready, just that we're getting some of the job descriptions and so forth done in that regard. But we're looking at least 10 persons to be able to bring the ministry up to where it needs to be, sir.
Okay, thank you. Any other questions on this area? There are none, then we will move on to talk now about and question the witness on performance management and reporting. And the member from East End is going to lead off in the questioning on that.
Thank you, Mr. Chairman. Through you to Ms. Pucci. From the Auditor General's report of 2017, they made some recommendations, and recommendation number 7 of that report said that government should put in place a performance management and reporting framework for the Cayman Islands health system to inform decision-making and provide accountability to the Parliament and the public. This is in support of what my colleague from West Bay Central made a note of earlier. The Public Accounts Committee of March 2018 then further said that the Medical Office of Health should collect relevant health data from the private sector as well as the HSA in future, and should publicly report on both sets of data on a regular basis to help inform public policy and decision making again. And then in January this year, the ministry said that the Chief Medical Officer intends to develop and roll out a national healthcare standards program and provide annual report on the healthcare system to be tabled in Parliament. What is very concerning now is that the CMO has tendered his resignation. So based on that, can you give us an update on what the collection of national data from all healthcare providers and the private HSA and private sector, when will that commence?
Mr. Chairman, through you. So in terms of your last point there, in terms of the clinical data, clinical standards data, I know that that had commenced. There was an initial meeting that had just started just before we went into the whole COVID situation. So CMO had actually had a group of stakeholders already in talks and how we were going to look to roll out national clinical standards in that regard. So that paused in that aspect. So we're not yet, we haven't yet moved that forward. But it is something that is necessary and we see as a priority area, so that there are those guidelines around that, so that we have better understanding of the actual, what's happening in practice in the healthcare industry as well. So that will go forward, and that is something that we would still put forward with a new CMO. In terms of other performance reporting, we do get necessary information when you're asking for it. The medical officer of health would be more in tune with that regard in terms of getting data from other providers and so forth. That is the position that would deal with that. In terms of mainly what we do, in terms of what I've seen, of making other decisions and other policies, it's mainly drawing on your other partners. Even if Cayman has very limited data, then having your other partners to be able to supplement and give you some more guidance in terms of, well, this is the data that you have, or these are the KPIs that we would be expecting, and in that regard. So like I said, Cayman, we're blessed and cursed almost in terms of not having all of the bad data out there, but at the same time trying to keep it that in that vein, that we don't want to. Our numbers are low in other aspects, but then it also inhibits how much data then we have from a local population. So you're relying more on other data from elsewhere.
Thank you, Ms. Butcher. Through you again, Mr. Chair. We know, as said a couple of times now, that data gives us information we need to make decisions in the Parliament and provide accountability to the public. So, therefore, can you also update on the plans to develop a national healthcare standards program and the annual report from the Chief Medical Officer, whoever that person may be?
Mm-hmm. Okay, Mr. Chairman, through you. So, CMO would have also, I think you may have heard that in terms of his response to his resignation as well, that he is also still working on that report in terms of what he will put forth as that he's seen during his time here, in terms of those, what needs to drive then the standards that he's seeing. So that will be forthcoming. But yeah, it's absolutely critical that we do have that kind of information to be able to make the relevant decision making that needs to happen.
So can we get an undertaking from you that we'll get that report before the CMO leaves this jurisdiction?
Yes, sir, absolutely. We will expect that would be forthcoming. Yes, sir.
Thank you, Ms. Butcher. Mm-hmm.
There are no further questions on this topic area. Then we'll move on to the next one, and that is health statistics. Get my words right. And member for Georgetown South.
Thank you, Mr. Chair. Through you, Mr. Chair, to the Chief Officer. The Office of the Auditor General reported in 2017 that the Cayman Islands appeared to perform well in many categories of health outcomes, but limitations of available information may obscure some important differences. Health statistics used reflect averages for all Cayman residents and do not take account of the high population of non-Caymanian expatriate residents that only live in the Cayman Islands during the healthiest years of their life. Using averages risk distorting the apparent performance of the health system and may obscure differences in outcomes. This is important for the government to know when planning and establishing policies, as our members of this committee have indicated earlier, for health care needs in the longer term. The OAG recommendation states that the government should ensure that health statistics used for purposes of planning, management, and accountability distinguish between Caymanian and non-Caymanian populations. We also note that the government did not accept this recommendation. So my first question to you is, why didn't the government accept this recommendation?
Mr. Chairman, through you, unfortunately, it's difficult for me to say why that wasn't accepted at that point. So I can't elaborate too much on that in terms of that decision that was made, given that I was not, privy to that part of it. However, in terms of knowing what our numbers are, knowing what our population numbers are, Caymanian or non-Caymanian, I'm not sure that would be anything that would be adverse. I think that would be helpful in terms of policy making. However, as I said, I don't know all the intricacies of why that was not accepted at that point, so I can't really speak in that regard.
Thank you, Chief Officer. Through you, Mr. Chair, to the Chief Officer again. Can you state what the advantages and disadvantages to analyzing and monitoring information on health outcomes for Caymanians and non-Caymanians?
Mr. Chairman, through you. So in monitoring outcomes, it helps to make better decisions, drive policies, to know then where we're lacking or what we need to strengthen, or if we are already measuring certain outcomes and those are being favorable where we want them to see, then it would be now diverting resources then on to something else. So if we know what those are, then surely that has to help to drive better decision making. I can see in the absence of that, then it's more theoretical, but you would want to know that you are being very realistic for your population needs, so that your population, your persons are getting the adequate help that they need.
Thank you, Chief Officer. My question now to you is, now that it's the new government, do you think that this current government would accept this recommendation to include non-Caymanians as well?
Mr. Chairman, through you, I certainly can't speak on behalf of the government, but it's certainly something that I can take forward and have some discussion in that regard, primarily with our minister, and then beyond that with her colleagues. Yes.
Through you, Mr. Chairman, to the Chief Officer, thank you for that, and I think it would be good information to collate for future reports and stuff to determine Caymanians versus non-Caymanians in terms of the health issues that they experience. So I think that would be a good thing to take that forward through your minister. Thank you.
Chief Officer, I do have one question I want to add in ask in this area of data. I remember it's quite a few years now. There was a draft of a bill for a national cancer registry that would have made it a requirement for doctors and those in healthcare to report the incidence of cancer in the country. I do know that we have a cancer registry at the moment, but it's purely voluntary. So it's really difficult to make any informed decisions about the incidence of cancer prevalence if it's purely voluntary, because you don't know what you're missing. Is there any attempt or any plans by the ministry to try and push to get that legislation, bring that legislation back to the forefront?
So, Mr. Chairman, yeah, I haven't had any discussions with my current minister in that regard, but it's definitely something that I can put forth, have the discussions to see if the government, has any views in that regard on moving that forward again.
Thank you very much for that commitment. I mean, I think the whole thing just really goes to the heart of this collection of really reliable healthcare statistics for the country. Any other questions on this area? If not, then we will move on then, and let's ask questions now on the K-Health program. And I believe the member for Georgetown South, you're going to lead off the questioning here.
Thank you, Mr. Chairman. Through you to the Chief Officer. In 2017, the OAG reported that the K-Health program was a good example of chronic disease management and was focused on the medically indigent population, at that time over 1,200 patients. The OAG recommended, that's recommendation number 8, that the government should evaluate the design and performance of the K-Health program and, as appropriate, extend it to cover a wider population. The original response stated that an evaluation would be completed by the end of March 2017. In June 2018, the updated stated that the K-Health program would be extended to members of the Cayman Islands Civil Service Association and HSA staff. However, in January 2021, the minister stated that the planned rollout to civil servants had not been implemented. First of all, can you explain to the listening audience and to this committee, can you give us some idea of what the K-Health program is about? I'm not really sure, so if you could just give us what does that cover, what are the benefits of that? I think we can start from there. Thank you.
Mr. Chairman, through you. So my understanding of the K-Health program was to be able to pair your primary doctors with, like, for example, a patient, and that would be tracking that patient's primary health issues and so forth. Being able to provide that support, having that initial interaction with your patients, being able to know their situation and helping not to get to chronic illnesses and so forth. So it was giving that better health outcome in an ongoing basis before you get to the real serious issues, and ensuring that persons were getting the necessary care to kind of prevent that. That was my understanding. That is my understanding of what the program aimed to do. In terms of how it is at this point and why it wasn't rolled out to civil servants and so forth, I'm sorry, I can't speak to that. I would have to take that away and try to understand that a bit better. I know that the HSA had talks about energizing the program again and being able to, almost like K-Health 2.0, having some other suggestions on how that might be rolled out and be more feasible. But I don't have those details as yet. I haven't seen that completed proposal as yet.
Thank you, Chief Officer. Through you, Mr. Chairman. So can I have an undertaking from you that this will be discussed in terms of the extension and further plans to further include the K-Health program and to extend that on to the civil servants and HSA?
Mr. Chairman, through you, yes, I will take it further.
Thank you, Mr. Chairman. Through you to the Chief Officer. So, does the HSA currently have a mechanism for tracking these diseases for all patients, for all residents, or it's just for the indigent? And is it current? I want to know whether it's up to date or not.
Mr. Chairman, through you, so HSA would obviously have the statistics for those patients that they see and for whom their doctors would dental, so they would have that information for any that are on that program and that their doctors are attending to. They would.
Through you, Mr. Chair, just one follow-up question in relation to the K-Health program. I noticed that when it was rolled out for the pilot program back in 2010, the reports showed that there were positive outcomes, especially with patients who had diabetes or high blood pressure. Those conditions tend to get under control a bit more. I know this was before your time, but I'm just wondering, I know the member for Georgetown South just asked a few questions about it, but do you have any indication at all, like was it a cost factor, why it wasn't continued? I mean, do you know anything at all of why? I'm just trying to understand why the government wouldn't have continued the program when we were seeing positive results, especially with our most vulnerable, which at that time was only 1,200, but I'm quite sure that the numbers have significantly increased.
Mr. Chairman, through you, so I think that the program still continues, but in a very limited capacity, in that the HSA, for example, still tracks those patients that they've been monitoring in that regard and that they've paired with those primary providers on their end in terms of how it didn't progress and develop into a bigger scale. That's the information that I don't know in that regard. But I know that, from discussions that I've had previously, it was anticipated that tracking those patients would help to be able to deter then those serious illnesses if you're having that ongoing care. But I would need to investigate further with them, have further discussions as to why it didn't roll out or expand beyond what was initially anticipated.
Any other questions? Let's turn now to the next segment to deal with, and that is a legislative framework. And for that, I will invite the member for West Bay Central to lead off the questioning.
Thank you, Mr. Chair. Through you, in relation to the recommendation number 2, where the government should proceed with a law review for the systematic updating of the health system legislative framework. Ms. Pucci, can you just advise us in relation to the Pharmacy Act? I know that's just as old as I am. Back in 1979 is the last time that had been looked at. And then the nursing profession didn't seem to have any type of regulation by way of primary legislation or regulations. Is there any plans to proceed with a law review for the systematic updating of that framework?
So, Mr. Chairman, through you, my understanding is that there was a draft pharmacy bill, and that was something that was available, I think, for a couple years now. However, there were some issues, I understand, in the draft that was there, and it hadn't progressed beyond that. But beyond that point, what we have currently done is put that same draft bill before the current Pharmacy Council, mindful that they're made up of different members at this point, and having them to review what was previously drafted so that we're not exactly starting from scratch, and they're able to then give their feedback on some of the recommendations there and some of the provisions in that draft legislation so that that can move forward. So that's currently with the Pharmacy Council for review and then feedback then to our minister in that regard.
So that's something that's actually ongoing right now then?
Yes.
Perfect.
Yes.
Thank you.
And we've also, just to add on that, in terms of your other part of your question, you know, in terms of legislative review, we've had initial discussions with the various councils, also with the health regulatory department, looking for recommendations, giving us feedback in terms of where they're seeing some gaps in current legislation that may need to be strengthened. So we've asked for that feedback. We've had ongoing discussions in that regard. The health practice law is one of those areas that we're looking to do a review on. We haven't commenced the stakeholder group as yet on it, but there is a tentative date planned in October to do that, to bring together the relevant stakeholders so that we are able to do a review of that law. The public health law has been ongoing a review of that as well.
Thank you very much.
Through you, Mr. Chairman, to the Chief Officer. Can the Chief Officer sort of give some kind of timeline as to when these laws or these bills will be brought to Parliament? Because I know a lot of these, what you've indicated, the Health Practice Act, Pharmacy Act, and the Public Health Act really need updating. So we need these to be brought to Parliament as a matter of urgency. I don't think we can delay these much longer. As a matter of fact, when I was there, I was in a councillor in the Ministry of Education, but one of my constituents approached me about an issue with the Public Health Act. One of the issues was, I think, regulating beauty salons and stuff like that. And this is something that's been ongoing for, I would hazard to say that it's been about 15 years or so. She's been trying to get some regulation with the beauty salons and stuff, and it's just never occurred because we're waiting on the I think it's the Public Health Act to be updated. So please, I beg you to try to endeavour to have this brought to Parliament as a matter of urgency. Thank you.
I would only make us try to reinforce the plea, really, Ms. Fucci, with regard to it. I mean, I think particularly something like the Pharmacy Act that is well nigh 40 years since it was implemented, 79, and hasn't been updated. I know that one existed, and as you said, that's still with the council, looking for further update or review from them. The urgency is very real, and I guess putting in my own plea and encouragement to try and see if we can get some of these things here to Parliament for consideration.
Yes, sir. Thank you, Mr. Chairman. So, yeah, I'll certainly take that forward. Like I said, the feedback that we have requested from the council and the current review, legislative draft review that we've gone through with Public Health Act, we will be going through those with our minister, and then the government can decide at that point if what they accept and bring forth then to Parliament, sir. Thank you.
Mr. Chairman. Mr. Chairman.
Any other member for East End?
Thank you, Mr. Chairman. I would also like to stress the urgency of getting that review done, but I also want to ensure that all relevant legislations that pertains to the Healthcare Act and healthcare is also reviewed as well. So it must be an all-encompassing review to ensure that we touch all the areas that needs updating.
There are no other questions, and let's turn our attention now to health insurance. And I'll call on the member from Savannah to lead off the questioning there.
Thank you, Mr. Chairman. As a result of the Public Accounts Committee first hearing on this report, it recommended that the Ministry of Health, in consultation with the Health Insurance Commission, should review relevant legislation to enable private sector coverage into retirement. In June 2018, the minister stated that it had engaged a consultant to conduct a feasibility study and determine the premium for standard health insurance contract for persons aged 65 and over. In January 2021, the minister stated the study was completed and a draft report prepared in mid-2019. Could the chief officer now say if an update on the outcome of the consultant's feasibility? Where is that to date? As we know, everyone, health insurance is an extremely major concern right now, so I would appreciate if you could give us an update.
Mr. Chairman, through you, my understanding is that the prior consultation done in that regard did not produce feasible results in terms of an affordable premium for the vulnerable group that was in question at the time, like the over 60s persons who had retired, and my understanding is that that was not a feasible, affordable premium at that point, and that had not progressed. That is one of the issues that I've had discussions with the Department of Health Regulatory again and the Health Insurance Commission on how we can look back at that study that was done and what recommendations we might have to be able to drive it forward. Being mindful that one of the priority areas expressed by the current government is with respect to that national affordability of national health insurance. So that is a priority area that is being progressed in that regard.
Thank you, Chief Officer. My other question is plans to change the requirements for private healthcare insurances to extend cover beyond retirement age. Can you give us an update on that?
Mm-hmm. So that also is what would be discussed, Mr. Chairman, in conjunction with that report, to now be able to see what the government would be able to put in place to ensure then that population group does have coverage and does, because it's not always that persons are unable to afford, sometimes there's no access. So we're trying to understand that where that is possible, that access can be provided, that is done. So that is part of the review in that regard.
I thank you very much, and this is a major concern in our Cayman Islands, and I look forward to seeing some updates on this. Thank you.
Through you, Mr. Chair, I just want to reiterate my colleague from Savannah. We've all had representation from our different constituents on this particular matter of health insurance coverage for people once they reach retirement age. This is very critical, and we must find a solution to afford our people who have gone into retirement the critical health coverage that they need. And if we can't find something, well, then we as a government must then direct a solution be found.
We now turn to inspection and registration, and again we will, the member for Savannah will kick off the questioning there.
Thank you, Mr. Chairman. The Auditor General's report from 2017 found that some practitioners and facilities were not registered and that some facilities had not been inspected as required by the law, which exposed patients to risks. The Auditor General's report recommended that the government should review policies and practices for the registration of practitioners and the inspection of healthcare facilities, and that it should take steps to ensure that all qualified practitioners are appropriately registered and regulated, and that all facilities at which healthcare services are provided by qualified practitioners are appropriately inspected and certified. The original management response stated that the review of policies and practices would be completed by the end of July 2017. In June 2018, the minister provided a further update, but it was not clear if it had taken any action, and no updated time scale was provided for implementation. Can the chief officer say if there's an upgrade on registration of healthcare practitioners and inspection of healthcare facilities to date?
So, Mr. Chairman, through you, this was part of the ongoing health practice law review. The recommendations in that respect in terms of strengthening to make sure then that there is no loophole in that regard. So it is something that's being undertaken by Department of Health Regulatory. And I know that the department is also strengthening their review and verification of such persons who deemed or express an interest to be able to perform in that section, in that sector, and to be able to do the relevant checks in that regard. So they are looking to streamline that, but it is something that has been identified in terms of the health practice law review ongoing.
I thank you, Chief Officer. And also, could you give us the reasons for the delays in updating the policies and the practices?
Mm-hmm. That is ongoing right now, Mr. Chairman, through you, in terms of now being put forth. I'm not exactly sure, like in previously, what those delays were, but it is something that we've highlighted and put as a priority.
Chief, how do we get a situation here in this country where you have persons and facilities not registered? I mean, certainly the legislation certainly exists, but according to this report, those are some of the findings. I'm just trying to process that.
Yes, sir. So, Mr. Chairman, through you, so in terms of not being registered, it may be more in terms of enforcement. Everybody who sets up a business and wants to act in a health profession and offer those services have to be registered in that regard. In terms of which persons aren't and still allowed to be operating, that would need a bit more investigation to understand what those are. And I think the best person placed in that would definitely be the Director of the Department of Health Regulatory, so that we could ascertain that. But in terms of persons who are registered and persons who are performing services, those inspections do occur. And if it is that someone is illegal, then there is that arm within their remit to be able to deal with that.
Thank you, but my real concern is around people or healthcare professionals who are not registered. I look at, the ongoing inspection is only part of it, but how is it that they get to operate in this country and they are not licensed? I mean, you mentioned it being a regulatory enforcement, but I mean, we do have a regulatory enforcement arm, and, with the licensing requirements, everything that go with it. I mean, healthcare is probably, one of the most regulated professions here in Cayman, and yet we're seeing that there are lapses here and that people are able to let's just say, operate under the radar.
Mm-hmm. Well, Mr. Chairman, through you, in that regard, if that is occurring, then persons are to report. If that is the case, to the Department of Regulatory Services, so that we can ensure that that's not happening. You know, I would want to look into further and probably discuss a bit more in terms of the observation and recommendation there, just to understand that clearly a bit more with the Auditor General's office in that regard. So if there were instances of person operating who were not registered, or if it had to do with you know, different standards, maybe of registration or so forth. I'm not sure in that regard, so perhaps some clarity there would help me.
Auditor General.
Mr. Chairman, through you to the Chief Officer, if she has our report from 2017 in front of her, paragraph 54 gives some specific examples about the counselling centre and Haven Residential Centre, and I seem to recall it's to do with where there are health practitioners but operating in non-health facilities. So I think it's that interplay between social care and health care where there was an issue. But if you've got it in front of you, Chief Officer, if you look at paragraph 54, that gives a specific examples. Thank you.
You're referring to the original report?
Original 27.
Okay. Okay, I don't have.
Okay. Thank you for the clarity there. So in terms of not being registered, I don't know if there's like confusion in terms of the waiving of fees in that regard for those persons who may be employed within those certain services. And just going back to the report, so it was speaking to registration fees may be waived for practitioners who are government employees, and the councils do not include practitioners on their registers unless fees are collected. However, so if you're saying that they're not in that list of those persons, there would be, they would have to be qualified persons to be even deemed to be working in those professions in the first place. So if they're not on your registered list, then we can understand if they're somewhere else in terms of them not having those fees paid, but they certainly wouldn't be able to provide those services if they were not qualified in the first place to do that. So I don't know if there's some confusion in terms of the registration aspect of payment of fees in that regard, but because I know then that if you're working in another government department, for example, or for a government entity, that those persons, the fees are waived in that regard. Government paying itself, probably from that standpoint. However, the persons who carry out those duties would have to meet the requisite qualifications and experience as anyone else who would be a practitioner in the respective area.
Thank you, Mr. Chair. I'd also like to just touch on this recommendation number 5, and just the need, as everybody else has said, for this act, the Health Practice Act and regulations, to be prioritized in terms of being updated, and then the policies and procedures of the same. And just looking at the report from the Auditor General from 2017, paragraph 56, one of the things that they highlighted, it's actually now registered facilities. So you look at places like the Pines, where they have registered practitioners providing health services, but they're not being inspected or certified, even though it meets the definition of a healthcare facility under the law. So the importance of highlighting this is that failure for us to address this then means that the facility there may be a risk with the facility failing to provide the appropriate healthcare environment. So when we go back to looking at, protecting the elderly, protecting the most vulnerable, we want to make sure that we have this act, regulations, and policies in place to ensure that places like the Golden Age Home, like the Pines, that they're all being inspected on a regular basis.
The next area for us to examine is one of resources, and I know it came up earlier, and we exploited that quite extensively, but I'll call on the, recognize the member for East End who will lead some further discussion and questions in this area.
Thank you, Mr. Chairman, and through you to the Chief Officer. Ms. Pucci, I know that we discussed the resources earlier. You also alluded that there were some deficiencies in certain areas and pretty much at the management level. Can you give us an update on any further staff requirements that you need to be effective to delivering these reports and to do what is expected by everybody else from your ministry? Can you give us a further update on what additional staffing requirements you need that would form part of the 22 and 23 budget cycle?
So, Mr. Chairman, through you to that question, sir, so we've identified some additional policy advisors that we would need some additional help there in that regard. As I said, we've strengthened up to one deputy chief officer. We're adding another that will help to give us capacity in that regard. We're looking at, like I said, another communications person, a business manager for our risk area, FOI, information rights, that sort of stuff. We've added a more senior HR manager that would help us with dealing with some of the strategic issues. We've not had that in the past. It also helps to address succession planning and capacity in that regard, so that we're looking at our resources and the aging population of our unit, our departments, and so forth, to ensure that we have that continuity and to be able to just have that capacity available. It's obviously very difficult otherwise to be able to be forward-thinking and to be able to be ahead of it. You want to be more proactive and looking at that, having the necessary persons there who are able to have the time to do the research and so forth, so that we're looking at our procedures in that regard, implementing a bit more in terms of timelines for review of our legislation, and not just when somebody highlights a deficiency, but actually having certain timelines for review periods. In that, we've implemented more of an action tracker approach as well, so that key areas that may not have progressed in the past, and stating why they may not have progressed at that time, but so that that is more almost like a statutory document for us from our ministry standpoint, so that as we have changes in personnel, changes in government, we know what those items are. So we have that ongoing list that stays with the ministry and not so much with a person, so that when that person leaves, whoever comes in already knows, well, these are the things that we were working on, these are the things that didn't proceed, and here's why it didn't proceed, and so forth. So it's just having more resources in that regard. Using technology a bit also too, so not saying that we have to have persons for everything, but being a bit more innovative in that regard, so that we're more on top of what we need to do from a ministry perspective. And as I said, continuity is a huge gap that we've identified. So trying to put some mitigating measures in place there that we can go forth much better.
Thank you, Ms. Pucci. You touched on two things I was going to ask you on, but you touched on which was the succession planning and the use of technology. If we fast forward now to September 2022, when we ask, give us an update on recruitment, can we get your assurance that you will do your best to fill those positions you need to make you work more effectively in delivering on these recommendations from the Auditor General's report?
Mr. Chairman, through you, absolutely, sir. It's such a priority now in terms of recruitment. We just have to. We're very stretched, and in that regard, so that's not even an option for us at this point. It's a need.
Thank you. So just clarifying, we're going to be able to tick the box next to number 4 next year.
anything, Mr. Chairman, through you, anything that's in my control that I'm able to deliver, absolutely, sir. That is the undertaking.
I think it would be remiss of me, Ms. Pucci, if I didn't just touch a little bit on the CMO position, knowing well that the incumbent has tendered his resignation. And what are your thinkings at this point? I recognize still early days, but what are your thinkings with regard to recruitment, the time it will take? Will we end up having an acting position, that sort of stuff? Just tell us what your thinking is at this time.
Mr. Chairman, thank you. Obviously, that is a priority for us, especially given where we're at in a pandemic, and we've seen how beneficial it is to have that CMO on site here within Cayman Islands, and that is a very critical post for us. So it's not something that you know. And I'll just, be a little bit informal here in this regard. And I said to Dr. Lee, are you absolutely sure? Is that your final answer? And he's, having to leave. So I just wanted to thank our current CMO for all of his efforts and that, that he's helped us in that regard with the pandemic. Obviously, we still have to go forth, and we have to make sure then that there is no gap in that level of policy advice and so forth. So that is being discussed at the very highest of levels, because we understand the importance of that role to our overall national strategies. So we do not anticipate that we're going to be in a gap area in that regard, that we will be able to have someone come in and have that handover time, almost transition time with the current CMO. So we're looking in that regard to have that fill, pretty shortly, that more on a temporary basis, so because of our time constraints. But again, looking at how we then move forward in terms of the actual filling of the post forthright. We are also looking, as I said, at strengthening some of our more senior leadership in the public health area, so that way we also have that level of capacity to draw on in terms of, we currently have a medical officer of health. We're looking more at adding some additional resources at that top level, even in terms of national epidemiology, and having those persons who are at that level available to help us in that regard. But we definitely, it is a priority area for us, and we have been, having the discussions at a very senior level to have that gap filled. Yes.
Thank you. Can you just confirm for me, the CMO, his office resides within your ministry, am I correct?
Yes, sir. So the CMO and the medical officer of health are ministry employees. Those functions are carried out on behalf of the ministry, given the national nature of the positions. Yes, sir.
Thank you for the clarity. Any other questions? We're free, Stan.
Through Mr. Chair, are there any specific areas that you're looking to recruit the new CMO from? Is it going to be regionally? Is it going to be UK? Is it going to be USA? But have you any thoughts in your, or even Cayman? Even be better, Ms. Pucci. Any thoughts of where you'll be looking towards recruiting? Preferably we find a well-qualified Cayman to fill that post first. If not, where are you looking?
So, Mr. Chairman, yes. So it will be the formal recruitment process where persons who are qualified and have the suitable experience are able to submit their applications in that regard. Once we get to that, we are still supported by heavily by Public Health England in terms of technical advice. So we do have that resource as a gap measure until we actually have another CMO in place.
Thank you, Ms. Pucci.
Let's turn now to Caymanian doctors and turn to the member for Georgetown South.
Thank you, Mr. Chairman. Through you, Mr. Chairman, to the Chief Officer. The PSC recommended in 2018 that the Ministry of Health should develop a policy on how to develop Caymanian doctors to board certification level and provide a grant to the HSA to fund these staff developments through proper training. I note that in June 2018, the government confirmed that the Minister of Education, where I sat as councillor, had made $500,000 available to fund scholarships to assist Caymanian doctors to pursue postgraduate studies to board-level certification. However, in January 2021, the ministry stated that it would check if a policy had been prepared on the development of Caymanian doctors. The PSC recommended in April 2019 that the Minister of Health should consider Canada as an option for Caymanian doctors to obtain specialty board certification. We note that the ministry has not responded to this recommendation. So my question to the Chief Officer is, can you provide us with an update on the development of a policy for Caymanian doctors?
Mr. Chairman, through you. So in terms of medical internships and training for our Caymanians who are pursuing medicine, the medical director at the hospital, at the HSA, Dr. Jefferson, is that person who leads that for us in terms of being able to identify suitably qualified Caymanians and interested Caymanians in certain positions or pursuing certain disciplines, and to be able to help to guide them in that regard in being able to achieve what they need to be able to practice and so forth at the end of it. So the ministry funds, in addition to what was provided to the Ministry of Education to fund Caymanians interested in that regard, the ministry also funds medical internship, a medical internship program through the HSA that is headed by Dr. Jefferson in that regard. So in terms of what I think from a policy standpoint, so Dr. Jeff is that lead point person who does advise, candidates in that. What I think where we may be able to improve in that regard is to have something a bit more documented, and also something that when persons are pursuing or interested in the medical area, to be able to guide them from the onset, so that persons know exactly what the requirements are and what they may need to do. So it's not, I think in the past, persons may want to pursue a certain career, and then at the end of that, then it's like getting to that realization that maybe they're not yet suitable, they have more things to do to be able to, when they think that they're ready to practice and so forth. But so it's really getting that guidance, and I know that the scholarship that is done through the Ministry of Education does, they liaise with Dr. Jefferson in that regard to ensure that you get that kind of technical, professional advice, even in terms of persons who are being afforded the scholarship. So I think that that is an area that can be strengthened, where persons do have that knowledge up front and that ongoing guidance. They're linked then to our medical director in that regard, who's able to provide them with that necessary career guidance, so that they know at the end of their time that they're able to assume the positions that they're aspiring to.
Thank you, Chief Officer. My next question then is, so it's Dr. Jefferson who will drive or develop this policy? Is it him that will actually be responsible to develop this?
Yeah. So the ministry, obviously, Mr. Chairman, will need to ensure that it is readily available for every person, like I said, who want to pursue that. But Dr. Jefferson, as the medical director of the HSA, is our point person in that regard. So he will help in terms of having recommendations and so forth, yes, in terms of driving that.
So the policy. Can we get some commitment that there will be a policy that will be established before long?
Yes, so Mr. Chairman, through you, so I will make the commitment to have that discussion in terms of the actual written policy. As I said, there are certain guidelines, but I think it needs to be a bit more open, transparent, so a person knows exactly what it is that they're looking for, or what we're looking for at that level. So students are well aware. But I'm not aware of a written policy. There are some guidance, in that regard that the HSC, like I said, Dr. Jeff will look for in terms of those persons. But to have a developed policy so that it's much more clear and transparent, that is the undertaking that we will look to institute very shortly.
Thank you, Chief Officer. Through you, Mr. Chairman. The funds that are allocated for these scholarships, these medical scholarships, they're $500,000 per annum. Can you confirm or advise this committee and the wider public, are those funds utilized on an annual basis, the $500,000?
Mr. Chairman, through you, I would need to get an update from Ministry of Education in that regard to see the uptake in that aspect. Yes.
Could I just ask if you could supply that update to the committee?
Yes, sir.
Please. Thank you.
Through you, Mr. Chairman, I have one more question. The PAC back in the day, I think it was the member for Northside at the time, Mr. Miller, Ezra Miller, really had concerns that Canada was not included for caymanian doctors to be certified. Can you give some idea of whether Canada would be a part of, would be one of the countries where caymanian doctors can obtain board certification?
Mr. Chairman, through you, that will certainly be part of the discussion, and in the development of policy, it would be to also be able to say why certain jurisdictions would not be recommended versus others. So that would be a part of it, yes, yes.
So if I could take that a little bit further, my understanding is that since we are not a primary licensing jurisdiction, that we rely on the licensing of doctors by other countries. And there's a specific list of countries which we accept. My understanding, correct me if I'm wrong, is that is limited right now to 7 countries. Mm-hmm. Is Canada amongst that list?
I do believe so, sir, Mr. Chairman. I think that list, though, is quite dated, and it seems that was the inception that we started with these 7 jurisdictions. However, I have not seen anything to say why it should remain at the 7 jurisdictions, or why other additional countries have not been added or have been considered. Obviously, there's certain research that goes into that to be able to add that, but the 7 countries were adopted some time ago, and we've actually had discussions as well with the Health Practice Commission just to understand what might be involved in terms of getting a bit more of a research review done on that to see what additional countries can be added.
And I thank you for that. But I'm not, certainly at this point, not advocating, specifically for the expansion of the list. I just want to understand, I mean, technically then, there shouldn't be any real impediments for Caymanian who wanted to go to Canada or any of the other 6 jurisdictions to take their medical training and get qualified. Is that a fair statement?
Yes, sir. So I think in terms of the Caymanian, it's student studying, it's more in terms of the curriculum that's offered and what the program is, not so much that it's the country, and if we're looking back at then students who are going on scholarships and so forth, in line with what the member was just saying just now. But in terms of licensing from a practitioner who already meets certain requirements in terms of residency and years of practice and so forth, that's where the 7 countries then come into play. And it's now looking at, is that list still relevant for us, or do we need to now look at other jurisdictions?
Okay.
Mr. Chairman.
Go ahead.
Through you, Mr. Chairman. Just going back to the PAC recommendation in 2018, and then government confirmed via the Ministry of Education they made the $500K available to fund the scholarships. Then in January this year, the minister then stated that it would check up us had been prepared on the development of Caymanian doctors. I find that a little bit troubling that 2 years passed. I mean, still checking as if there was a policy developed. Can you elaborate a bit more on why you think that that was not done in that 2-year period?
Mr. Chairman, through you. So in terms of a written policy is where I'm saying that I haven't seen like a written policy. Obviously, there's guidance that is considered, like I said, by the medical director in that regard, and the medical director being someone who is gives information then to the scholarship secretariat for persons who are looking to pursue areas of medicine and looking at scholarship there. So I can't say that there are no guidelines. I'm saying in terms of a written policy, that's where I have not yet been able to see that as yet, and something that we would need to ensure is developed, a written policy.
Thank you, Ms. Butcher. Through again, Mr. Chair. Can you give us an idea of how many Caymanian students are actually currently studying in the medical field, and how many have actually returned and are now practicing doctors, either at the HSA or elsewhere?
Mm-hmm. Yeah. So, Mr. Chairman, I'm sorry I don't have that information in front of me, but it will be something I can add in terms of when I'm providing the update of the uptake of the scholarships, then I can also add then the persons who we have currently practicing.
Thank you, Ms. Butcher.
Other questions in this area? We turn now then to costs of healthcare, and I turn questioning over now to the member for Savannah.
Thank you, Mr. Chairman. In 2019, the PAC recommended that the ministry should consider ways to reduce cost of health care, such as removal of duty from drugs and medical supplies, as well as reducing HSA's markup on the cost of drugs. We note that the ministry has not responded to the PAC recommendation. Can the chief officer say if there are plans to remove duty from drugs and medical supplies?
Mr. Chairman, through you, I don't have a lot of information on this one. I don't even know if that was accepted, that recommendation. So it would have to, it would need further discussions in that regard.
I take this that she will.
So I can undertake then to have further discussions and update then what the status of that one recommendation is. Yes.
Thank you very much. I appreciate that. Through you, Mr. Chairman, I'd just like to ask the chief officer if there are any plans for any upgrades at the HSA, specifically for the entrance of the hospital as well as room accommodations.
Mr. Chairman, through you, I know that Honourable Minister has expressed her desire for upgrades in that regard and to take a look at our whole operational aspect of the HSA, even in terms of just the aesthetics of the area and how we can make the HSA more inviting to our users. So I know that there have been some discussions in that regard. Also in terms of capacity, what is needed in terms of beds and so forth. So that there is some ongoing discussions in that regard with Honourable Minister and the HSA.
Through you, Mr. Chairman, I'd like to thank you very much for that, Ms. Pucci. Now that I have an opportunity, I just want to draw to everyone's attention that the health clinic in all the districts, I just want to send a big shout out to all those who have made some really, really good upgrades to the clinics, especially with me dealing with my mom at the Bodden Town Clinic. I've found this to be extremely a helpful place to go to now. Because of COVID, we're now directed more to the clinics. And I just want to send a big shout out to the ministry as well as to the clinics in regards to what they're doing to make the lives of our elderly and our children a bit more comfortable. It's an easy drive from Savannah to Bodden Town, and once you're there, you're greeted and you're made comfortable and you're seen by a doctor, and the nurses take extremely good care. So I think with what is happening now within our islands as far as COVID, perhaps people should consider visiting the district clinics a bit more. I know for a fact that the Bodden Town Clinic has gone way above and beyond in making sure that all their patients are well taken care of. And I want to really thank them for that.
Thank you for that, ma'am, on behalf of the HSA and the staff who really strive to go above and beyond on a daily basis. I'm sure they appreciate that. Thank you.
Through you, Mr. Chair. Ms. Nelly, I also want to thank you for your appearance here today as well. But I have one question, and that is, outside of the question my colleague asked earlier in terms of the plans to remove duty from drugs and medical supplies, are there any other plans being considered by the ministry to help reduce healthcare costs in this country?
Mr. Chairman, through you, obviously the ministry grapples with the cost of healthcare in many aspects, looking at it in terms of having to fund and to also ensure not just that the government has adequate funding, also ensuring that our persons and our local citizens are also having access to affordable health care. Like we said, we have a few studies that were done previously. Those with the retirement age was one of them. We also need to be looking at our indigent population, and that is very steady. Even if it's not increasing by leaps and bounds, it's steadily increasing, and those costs are accumulating quite highly. So that's always an ongoing concern, because we want to make sure that healthcare is managed in such a way that we're not drained at the higher end of it. That's where also then looking at the wellness aspect, which we haven't even yet been able to actually touch on from the ministry's standpoint. So the our minister has added wellness as a part of her portfolio, and that will really help to drive some of it. So initially, in terms of, we'll have the critically ill persons on that indigent list, for example, right now, who we must do our duty to provide the best health care that we can, but also mindful that the government also has limited resources as well. So looking at ways to reduce that as best as possible without compromising access or care. However, from the wellness aspect, looking at what demographics, what age groups, what categories of persons can we now tap into to be able to help that we don't get to that end, that extreme end of where you need really critical care that is very expensive. So the wellness aspect is still to come, and to be able to help to to mitigate some of those costs in the long run. Looking always at other ways in which you can drive down those costs and other ways to be able to still service our population. Something that just thought about in terms of is in the thinking stage, but not actually something that we've explored yet. Looking with our other stakeholders across the government in terms of what can we do to drive those costs down. Working with Cineco critically as being that insurer for us as well. Looking at is outsourcing certain things an option for us? Looking really holistically at what it is that we can do in terms of costs, and not just accepting that this is a population that will always be in that kind of cost, scenario. So those are things to come in that regard.
Hi, thank you, Ms. Pucci. And you've mentioned wellness, which plays a big part in helping reduce healthcare costs. I agree with that. But this is a big issue for the people of the country, and we need to try and figure out a way, whether it's through messaging on wellness or finding some other ways of reducing healthcare costs. But we must get to that point in order to make it affordable for our people.
Financial Secretary.
Yes, thank you, Mr. Chairman. I just wanted to elaborate, and I think it'd probably be for the benefit of the listening public as opposed necessarily to the committee members, because I suspect you, the committee members, already know this. With respect to what we've just been discussing about the duty removal on drugs, with the objective or the hope in mind of making those cheaper to the public. I just wanted to say that, many years ago, the procedure for changing the import duty rates for any item being imported involved actually changing the rates specified in a bill or in a law. And so the method was to bring an amending bill to the Legislative Assembly, to the Parliament, to change the percentage import duty rates that were specified in a law. A few years ago, that procedure was changed in that the Cabinet can now make changes to import duty rates in the government administration building, as opposed to having to formulate an amending bill and bring it to Parliament, which that process could take months. So the procedure is a lot quicker now once the Cabinet, the government of the day, makes a decision that it wishes to proceed with a change to the existing import duty rates. That is a much faster procedure now, and it can happen within a quicker time frame once the government of the day wishes to make a change.
Thank you, FS. I hope you don't mind me putting you on the spot, but just wanted to say, if I remember correctly, a review of the customs tariff bill or law was started some time ago. I do remember hearing it, because do you know if that's been completed or if there's been any movement there, sir?
Mr. Chairman, you put me on the spot as well. I don't recall that, but what I do know is that obviously the Cabinet in the past have been making periodic changes to various items in the customs tariff law. Changes have been made to educational supplies, etc. I'll have to check about a wholesale review of the customs tariff law to see if there is an ongoing general review of it. But I know that as and when something requires a change is pressing, it would be taken to Cabinet dealing with that particular aspect, as opposed to waiting for a general review. But I'll ask if a general review of the law is being undertaken. I don't recall right now.
And that's fine, so I do appreciate that. And I recognize that you're not a witness before us, so if you told me no, I would have said, okay, I'll talk to you after. But thank you very much for that clarity. Member for Savannah?
Thank you, Mr. Chairman. I have no further questions for Ms. Pucci or Chief Officer, but I'd just like to say a big thank you for your honest and candid responses today, and thank you for being here. We really appreciate your presence.
Member for Georgetown South.
Thank you, Mr. Chairman. Just one quick question again on the reduction of health care for elderly and our indigents and stuff. Can you give some indication of whether a capitated model would work?
Mr. Chairman, through you, I would not want to go through to say yes, no, and here's why without having really looked at that a little bit closer first. But any way that we're able to, have a more of a better handle on our costs and not having those fluctuating, escalating, and so forth, then from that perspective, and theory, you can see that as being something that would be desired. But in terms of a best model for us and whether that would work for our situation, we would certainly have to look into that a bit further before being able to say that definitively.
Thank you, Chief Officer.
Are there any other questions for the witness? I see members shaking their head. Member for Bon Down East.
Mr. Chair, if there are no more questions or while people are thinking whether they want to have a last one, I just wanted to say a few words as the former, and thank and once again congratulate the new Chief Officer and in this role. And I wish her well. She was strong then and will only become better. It was just the two of us during the pandemic, and it was always that we had the largest ministry, but somewhat the smallest complement of staff to assist with no deputies. Yet we were able to pull off successfully dealing with the with something in the world, not just Cayman, a pandemic. And on top of that, we were able to furnish the former government in 2017 to 2021 with the most tangible projects, including from new garbage trucks, something that's been desired to get us back on track, and you see that's pretty much on track now. The mental health facility, the ISWIM's waste management project, capping and remediating the landfill, expanding our culture programs and taking the largest ever contingent of Caymanians to Carafesta in Trinidad, and expanding our marine parks, building homes and buying over 35 acres of land for affordable homes, just to name a few. I wish the Chief Officer Pucci well, especially knowing her background coming from a Big Five company before joining the civil service. And I know that definitely she will be an asset, and some of these things that hadn't been achieved thus far, when she gets the support and the staff and complement, she will be able to achieve these, because she's always been a driver from that CFO role in leaving her there. And I want to also thank and make mention of Dr. Lee. We had some good productive times together, especially during COVID. And I pray whomever takes over, they will build on what has been left and make it better. It was definitely refreshing to have a full-time CMO and not an acting one, splitting duties. And it came at just a perfect time during COVID. And thank God that we had a full-time CMO. And I want to also mention that Dr. Williams, thank him for his acting role over the years. Thank you, Mr. Chair.
Thank you for those comments, member. So Ladies and gentlemen of the committee and to the listening public, this concludes this hearing of the Public Accounts Committee. I want to thank all the members for your participation in asking questions. Thanks also to the Auditor General and to the Financial Secretary for their interventions throughout the hearing. And lastly, but not least, Chief Officer Pucci, just to thank you as well for your presence here today and answering all the questions quite candidly and forthright for us. I join with other members in just congratulating you on the confirmation of your post, and I do wish you every success, and I know that you will grow and mature into an excellent Chief Officer, so I do wish you well. That concludes our proceedings for today, and thank you all for listening, and until we next meet, thank you.